my name is Zamorano. My background is healthcare and business for 20 years. I'm a new family nurse practitioner with only 1 year experience. I'm a student at Bradman University working on my degree to become a doctorate in nursing practice. I will be presenting my clinical scholarly project of Stakeholder Educational Plan. Human papillomavirus is a sexual transmitted disease and it is linked to cervical cancer. Other than causing cancer, HPV is a leading cause of genital warts and other related infection. HPV is responsible for 70% of cervical cancer and 90% of genital warts in the United States. In addition, most of those affected are African American, Latinos, and other minority ethnic groups in the United States. Types 16, 18, 31, 33, and 45 are known to cause cervical cancer, which results in mortality in women. HPV is primarily transmitted through sexual contact, and this makes adolescents more prone to the infection. Despite the effects of contacting HPV, there exists no state or federal regulations that makes HPV vaccination for adolescents mandatory. Nonetheless, the Advisory Committee on Immunization Practice advocates for adolescents to undergo routine vaccination. In spite of the significant advantages associated with adolescent HPV vaccination, it remains low among qualified Latinos, boys and girls 9 through 17 years of age in comparison to general population. With a population of 50.5 million people, Latino remains more susceptible to HPV when compared to general population. In addition, Latino women have been found to experience higher level of cervical cancer when compared to other racial and ethnic groups. In general, Latinos suffers more HPV preventable cancers, and in spite of their susceptibility, the level of participation and completions of the HPV vaccination remains below recommendation. Notably, the population of Latino increases, the number of children prone to HPV-associated cancer has also increased. The growing population of Latino children is at risk in developing HPV and cancer. Eligible Latino boys and girls in the U.S. have low access to HPV vaccine. Educational theory and conceptual framework. The key stakeholders are identified are the healthcare professional, school board, Latino children between 9 and 17, and their parents in the Riverside, California. Health professionals that will be involved in these projects are school nurses, nurse practitioners, and primary care providers. There are individuals who are primarily involved in promoting health, wellness among the children, HPV awareness, and HPV vaccination availability. The local government includes school boards' participation in strategies and processes for obtaining informed consent. The school board includes administration, teachers, and school nurses. With appropriate resources and partnership, the school could carry out vaccination-related activities such as educating students, parents, and communities to developing policies supporting the vaccination, providing vaccines, or serving as the site at which school nurses and nurse practitioners administers vaccines. This quality improvement project is based on utilization of evidence-based practice to improve HPV vaccination rates among adolescent Latino children in Riverside, California. The project will be implemented in a time frame between 3 and 4 months, involving health practitioners, healthcare institutions, and community members in the Riverside County. Although the organizational climate to HPV vaccination in Riverside County is unclear, research evidence indicate that most Latino parents are unaware of the vaccination. Therefore, the project involves assessing parental knowledge about HPV in order to initiate the innovative culture that enhances HPV vaccination rates. Prior to implementation of this project, an assessment of parental knowledge about HPV vaccination will be conducted using questionnaire. Educational intervention. I will be using client education model to provide a framework for educational intervention because school nurses and nurse practitioners as educators are the liaison between medical and school communities. They can be considered trustworthy agents for influencing vaccine uptake. School nurses can be readily available as health service provider to Latino parents and children, and they can offer medically accurate, reliable information and resources about HPV vaccine. School nurses' knowledge and attitudes, perception of their role as HPV opinion leaders, self-efficacy is important in engaging parents and students in HPV decision-making process. Implementation plan. I'll be choosing 5 public schools such as this one will be randomly selected in Riverside County. Children aged between 9 and 17 will be selected and provided with questionnaires regarding parental knowledge about HPV vaccination, which they will be requested to give to their parents to complete. The children will be able to bring back the questionnaires and will receive rewards such as extra credit points. Among the return questionnaires, the ones that completed by Latino parents will be selected and used in the assessment. The Latino parents who have indicated that they have no knowledge related to HPV and have chosen not to vaccinate their children will be emailed a video or a DVD with information about HPV. After watching the video, a follow-up call will be made to inquire about their perception. The questionnaires and the videos will be both in Spanish and English language. My CSP project hopes to improve parental awareness through educational program of HPV vaccines among Latino parents. This could increase their level of early vaccine uptake, hence decreasing adolescent risk for cancer and HPV infection. Thus, increasing vaccination uptake among Latino adolescents is necessary because it can also reduce the high mortality rates associated with HPV infection among Latinos. Subsequently, the financial problem that the Latino community suffers when undertaking care for patients with HPV-related infections and cancer can also be minimized. Cancer infection and death among women can be also reduced, especially when Latino women allow their adolescent children to participate in HPV vaccination.